good evening to everyone who has just joined us at Kopi Events. This is Vance live from Kopi Events Studio. And yes, and today's topic is all about the pancreas because why? This is the month of pancreas awareness. So before I bring in my guest speaker, let's try to understand a little bit what is pancreas here, right? The pancreas has two functions, the endocrine and the exocrine. Its endocrine function is to produce the chemicals or hormones that regulate blood sugar, such as insulin. Its exocrine function is to produce enzyme that help to digest the food. The third Thursday, 18th November. In fact, I was just told the whole month of November is a diabetes month and as well as the pancreas as well awareness, right? The pancreas cancer. Um, as I mentioned, on these days, people across the globe come together to raise awareness from the symptoms and the risks of the disease and the urgent need of the earlier detection. We are privileged to have with us our guest speaker, a consultant from Seng Hospital, Dr. Vishal, to speak with us. Dr. Vishal. Hello, doctor. How are you there?
Yeah, good evening, Vance. I'm fine. How
Good
are
evening,
you?
sir. I'm good, sir. Do you have a very busy day today?
Yeah, today was in the morning I had endoscopy and then I had a clinic and in between saw some patients. Yeah, fairly occupying day.
Thank you, doctor. Thank you
Yeah,
for allocating some precious time of yours. I mean, even though it's an hectic day for you, but it's a privilege to you. I mean, it's a privilege for us to have you on our show on talking
yeah,
about this pancreatic cancer.
yeah.
Doc, let's dive into it. But before we even want to go, I just want to know why you want to choose as a doctor and why exactly or specifically why a pancreatic surgery or surgeon.
Well, I think, by the way, I'm brought up in India. So now I am naturalized citizen, but my childhood and my upbringing is from India. In India, during the schooling time, is given that if you do well, in academics, I think you just go into medicine. That's the kind of herd mentality that there is no given. So you do, even if you not sure what you do, people just do medicine if they are well enough in academics. So I entered and became doctor. I had some MB because there was no doctor in family. So I think parental, I wouldn't say pressure, but there was a bit of nudge. If you become doctor, that's good because we have nobody in family. So I think that was fairly okay. The pancreas is always, is a perplexing organ because, not many people know about it. Is there, is doing important job, but is behind the scene working. So I think it's also the disease of pancreas are very different. They are very critical. There's no problem or suddenly there is a complex problem. So I thought it is interesting to me. Yeah.
Doc, because we before you even want to jump into the questions that we have for today, I
Yeah.
was also told that this month is actually the pancreas awareness and pancreatic cancers month. Is that where is it actually founded from, or where is it from? How many years ago? Can you just give us some information on that as well?
Yeah, I think so. What happens is cancer is a killer. Internationally, cancer is a killer. So I think a lot of cancers have gathered attention. And to give attention to a particular cancer, every cancer has been, given some symbolic importance to raise public awareness. So, as for example, breast cancer will be given a pink ribbon, pancreas cancer given a purple ribbon, liver is given a green, so on and so forth. So I think to raise general public awareness, there is this momentum to give some kind of symbolism to a particular cancer. Typically, these are given to very common cancers because they matter to the policymakers and to the patient more. So pancreas cancer symbolic, the purple color and all the symbolism has been a little bit later compared to the other common body organs. I wouldn't be able to tell you exact which year it started, but it's
Mm.
there since I have since time memorial. I have realized maybe more than a decade, 2 decade. Yeah,
Yeah, in a very interesting topic when we talk about this pancreatic cancer, because we always talk about all the other organs in the human body, the
yeah,
heart, the lungs, the bones, the muscles, the
yeah.
brains, and so forth, right? I mean, the liver, the kidneys. But unfortunately, or rather fortunate, I'm not sure why is that so. Why is that the awareness for pancreas is way much more less a comparison to diabetes. When they talk about diabetes, it's always about the pancreas, but not much of an exposure or talked about on the pancreatic cancer as well.
I think you are right. You hit the nail for today's dialogue. The problem lies in the public literacy, what we call as health literacy, public education, and all that. As I said, pancreas is always behind the scene, both structurally as well as functionally, and in terms of public dialogues. So structurally, if you look at it, pancreas located behind the stomach is fairly deep organ. So it's just located in front of the spine bone. So it's fairly deep. When your stomach ache, people don't say a pancreas problem is nowhere. Well, the other body organs are very well having their presence in social media, in normal public intellect, normal day-to-day conversation. Even a child knows about heart and lungs and brain. So as you rightly alluded, for some reason, pancreas haven't gathered attention. And it may be of interest to our viewers today once. I
Yep.
actually did a survey on about 500 of the Singaporeans who came to Tan Tock Seng Clinic. This was conducted about 2016. So we asked 500 Singaporeans about pancreas and pancreas cancer. And to my surprise, or not to really, about 20% of Singaporeans haven't heard of pancreas as an organ, and about 60% didn't knew much about pancreas cancer, while the statistics were very much kind of predictable for breast cancer, colon, lung, and all that. So pancreas, typically for unknown reasons, I think there's not much talk about it going on. Not many people know, not many people speak, and partly it is because the disease of pancreas are uncommon, and when they hit it so hard that they are lethal. Many a times they are lethal. So there's not much the disease process going on in the community. As with breast and other problems, people live long. People live 10 years, 20 years, 30 years after the diagnosis, while once there is a pancreas and cancer, the survival is shortened. So that same individual or their family, there's very little left for advocacy, because we are just dealing with the problem, and one fine day, we are gone. So the time of exposure, the intensity is so hard that the burden of duration is very short, episodic in people and families' life is an episodic moment. Yeah,
Thanks, Doc. Thank you. Then we also want to go in a little bit more deeper as we done with the introduction and as we get in deeper and deeper right now.
yeah.
Something about the pancreas, right? Is there some kind of presentation? Of course, we will talk about the presentations later. But in terms of a cancer, it could be lead to healthy lifestyle, overweight, not proper dietary, no kind of
Yeah.
exercises. This could be a lead to the pancreas cancer, doctor? Or could you
I
be
think
tell us something about the pancreas? Yeah.
Yeah, I think that's very important as we go into the Western or industrialization, and the sedentary lifestyle and the habits we adopt. Um, a lot of momentum has gained recently that pancreas cancer is linked to being overweight. Well, previously it is mainly about smoking can cause pancreas cancer, and there was some consideration with that drinking alcohol in excess could be linked to pancreas cancer by causing inflammation. But I think over the last 10 years or so, there is increasing awareness that being obese or being overweight itself contributes to pancreas cancer. So I think in the Western and many countries now, being overweight has taken over as one of the common causes of many body cancers, and pancreas is one of them. So previously, when we used to talk of causes of cancer in general, right? People used to say smoking and drinking and all that. But now, when we talk about cancer in general, being overweight or obesity is one of the prime talks. In UK, I think a few years back, there was a tabloid, national tabloid, which actually reported that obesity is number one etiology or cause of a cancer globally or nationally in UK. Yeah. So being overweight
Thank you,
is
doctor.
pretty, yeah,
And also when you mention about the symptoms and the signs, like overweight,
yeah,
because we do know that it's related to diabetes as well. I mean, of
yeah,
course, if time permits, we will go into that a little topic of that. But of course, the focus is still on the cancer. But as we live in a modern society with so much of comfortability around us, right? the air condition is on, the elevators, the escalators, the bus, the transportation. So we hardly move. So the obesity ratio is increasing. And
Yeah.
then as exercises start to pick up, people are starting to exercise and starting to eat healthy. So could we say, is it also because of the DNA or the genetics also plays a part in the pancreas cancer?
I think the genes and mutations of the genes. When I say mutations, that means some certain changes into the genes. We call as mutations. So some mutations are contributory to not only pancreas but many body cancers. So I think about 5 to 10% of pancreas cancer could be linked to the genes and some mutations. At the maximum, about 10%. But I would say in Singapore, the contribution to the genes and mutations is partly very minuscule, about 5%. But I think you got a very important point, because everybody who has a pancreas cancer, when we face a patient with a pancreas cancer, as a part of comprehensive multidisciplinary team, or the recommendation or treatment or care package, we would actually advise the patient to get the next of the kin, the families, the immediate families, consider some form of awareness, because they are at increased risk because of the gene transmission and so on. And we encourage our patients to get some form of genetic analysis as well. So many hospitals, including Tantoxen Hospital, we have a special genetic clinic, which is run by an expert oncology or geneticists, and they actually guide you about the further testing and the implications of the testing. So you're right, it could be genetic, but the proportion is a little bit lower.
Doctor, since we are in the symptoms and signs,
Yeah.
I mean, I read a journal not too long back. They talk about the dark colored urine, the light colored stools, jaundice, yellow skin, loss
Yeah.
of appetite, abdominal pains. So it looks like a lot of symptoms. But you see, there isn't any indication that you should go and check on your pancreas. I mean, no, I got a stomach pain, probably diarrhea. It always comes to that arrowing into that particular segment. But isn't it a bit scary that anything can happen to our human body, right? Especially our cells and our
Yeah.
organs. How do we how do we narrow it down?
I think it's extremely challenging to narrow down. I think for general public, the idea would be beyond the narrowing. The narrowing is for medical professionals and healthcare teams. I think for general public, the most important thing is to recognize the importance of all these subtle, the vague, the minor symptoms which persist. I think we all have experienced gastric flu, or what we call as gastric problems. Um, so that could also be one of the underlying symptoms of a pancreatic cancer. So in a way, I think the scenario of pancreas cancer is very diverse. It can lead to minor discomfort, which we can easily discount as a routine gastric problem, or it can be extreme situation like jaundice. That means yellowing of your skin and all that. As you alluded to, the urine becomes dark. I want to talk about two things here. The first thing is the location of the pancreas is located behind the stomach, but that part of the body where the pancreas located, that part of the body is actually called as the heart of the body. So now here, to avoid confusion, the true heart is the heart which you all know. But I think from the surgical perspective, or from the disease perspective, I think that part of the body is so crucial, because that part of the body is where the stomach is, where the gallbladder is, where the liver produces the digestive juice, and it comes out through a tube called bile duct. So that's the part of the body where the bile duct is. That's the part of the body where the big blood vessels which go from the intestine to the liver. There's the part of the body where there is a small intestine, and of course the pancreas is connecting to all these things. And over this lies the stomach and the large intestine. So that part of the body is so complex and so crucial that if there is a problem here, you can have a very diverse spectrum of disease. So I think that's one. Though it is not a true heart in a strict sense, but where the pancreas lies, that portion of the body actually is considered a heart by some surgical community. We describe it as a heart. It's so important. It's so critical. It's so difficult to deal with it in terms of surgical skills and technique. I think the second thing I just want to raise awareness today among our viewers and everyone else. If you have minor gastric problem, we all go to GPs or polyclinics, or sometimes even we buy from Unity, Guardian, and self-medicate, antacids and many other stuff. I think that's perfectly reasonable, but up to a certain point of time. So if your symptoms, you know, don't get improved, or there is a recurrence and relapse or persistence of those kind of minor symptoms, try not to neglect or ignore that kind, because easy in the busy lifestyle, that takes a setback. So many things to do, children, family, work. I think sometimes we all ignore our minor illnesses. So I think that is an important message, probably one important take home today. If you're dragging symptoms, even it may be simple bloatedness like gas or wind in the stomach, please don't sit on it forever. Of course, you can take some medications, go to your routine doctors whom you trust. But if there is a persistence or relapse, it could be one of the symptoms of pancreatic problems. And as we all know, I told you the pancreas is so deep. You can't check the pancreas by physical examination. So you put hand on the stomach, you will never know. Nothing. You can't detect a problem. So the only way to detect would be some form of blood test, some form of scan or an image. So I think it's important not to neglect the run of the mill, the common gastric problem. Yeah.
Very well said, doctor. Very well said. I mean, you spoke all the right tips for viewers to take back. But doc, I mean, as
Yeah.
we know that our cells turn against us at
Yeah.
certain point of time. I mean, we do not know why for the reason, and they become cancer cells. But the another part is very astonishing for me is the only place that we live in is our human body, right? When we
Yeah.
buy a car, we get all the manual, the instructions, the where's the tire, how's the engine works, and the kind of
Yeah.
stuff. And then the other part is when we buy a house, we understand the floor plan. We understand every single detail of those stuff. But
Yeah.
unfortunately, we forget to realize, or we fail to understand the
Yeah.
human body, right? So
Yeah.
I think that is where the lack of awareness or the exposure in terms of health
Hmm.
and fitness, I think, plays a very important part. What do you think about that, doc?
I think you brought a very relevant point, Vance. I think this is again that ties down to health literacy of the general public or population, and literacy with regards to the human structure and human function. And I think again points back to everybody knows a little bit about heart, a little bit about lung, a little bit about brain, but again coming to pancreas, again a problem. So I think what is happening on ground is not only in Tan Tock Seng Hospital, but many hospitals in Singapore as well as abroad. There is a momentum to to elevate the health literacy of general public population. And these are two ways. Number one is structured process and programs, and number two is episodic, sporadic, or an unstructured scenario. So, as for example, for Tan Tock Seng, we used to run annual public forum, so where we invite people. It was in auditorium before the COVID time, so we actually get about 200 to 300 participants real in the auditorium in Tan Tock Seng level 1. And is a seminar, so people can ask questions. There are live talks with all the experts, the surgeons, oncologists, radiologists, relevant. So we used to do that regularly, annual, so to just increase public awareness. The second, this is an unstructured, because you are just doing once a year, doesn't mean that people will have that knowledge. They may not retain, and they go home and forget. But the structured process, I think what we also have in Tan Tock Seng, and as I say, some hospitals including abroad, it's called mini medical school. So have you heard of this concept called mini medical school once?
That's right.
So I think what happens is there are certain group of interested people, including doctors, of course, driven by healthcare professionals, but especially interested and motivated parties related to healthcare profession. They all come together, and they actually conduct community events, and these are on regular basis. So actually they conduct like medical school. They conduct a session, didactics and some Q&As, just to impart the medical knowledge to the lay people. And from these lay people, they actually get a selected people who are more, can deep dive, can understand more. They call us community ambassadors, who will then go and disseminate to the wider community. So at the grassroots level, there is a momentum in terms of mini medical schools to elevate the health awareness and literacy. not only in pancreas, in many other conditions. And we in Tantoxen also, do such campaigns. Our corporate communication and other divisions actually do such things. Yeah.
Doctor, when we posted our posters out, in fact, I have a speaker who is actually from NUH as well. He spoke
Yeah.
very highly of you because you actually lectured him during his medical. As he was a student, so he sent his regards to you as well, which I will definitely will invite him later. Doc, I know we have a presentation file that you want to show us something. Do you
Yeah.
think that you want to jump in now?
Yeah, I think the first is this color. I
Yeah,
think
that's color. Yeah, that's right.
I think the color code is very important, and
Okay.
just for our viewers and audience in general, when we talk about cancer, we link it to a certain color and gives an idea about. So, as for example, we talk about cancer called melanoma. Melanin is a black color pigment. Of course, we know it is a black color ribbon. When we talk of liver produces digestive juice, which is green in color. So, of course, it's a green color. We all know pancreas, the breast is a pink color.
Thank you.
So similarly, I think pancreas is a purple, and I think it's interesting to know once when I was in Southampton as a fellow in pancreatic unit, they used to actually light up the whole mayor's building and some government buildings with a purple lighting in the month of November, and especially on the pancreas cancer day. So I think there is a policy. This is beyond a hospital or a doctor. This is a recognized policy by the politicians. So actually they to support or to endorse that this is the important problem. Actually, government and policy makers also can sometimes do such things, and I have witnessed that firsthand because I spent a year in Southampton. So I think that's what I wanted to share with the viewers about purple. So when we talk of pancreas, it's a purple color. Yeah.
It's a
And I
beautiful
have
color.
one
I think
more.
everyone should
Yeah.
remember, Doc. Everyone should remember.
Yeah, just to add, I think the lung cancer is a white color, and that's exactly opposite to smoking because the smoke is black color. So the lung cancer has to be anti-smoking. So they have come. I think these colors are also thoughtfully given. So there's some thought process behind color coding, as it's not random. Yeah.
Thank you, Doctor. So we will move on
Yeah.
to the slide right now. Um,
Okay.
there you go.
I think
So we are.
yeah, yeah. Yeah. You want to speak anything once? You want to share?
Yeah, Doc. I mean, we mentioned earlier on about the weight loss, but it's a bit surprising to see back pain in the presentation because we know bloatness, loss of appetite, nausea, vomiting, but back pain. Everybody is sitting 8 to 10 hours, sometimes even 16 hours. They are sitting down. That
Yeah.
could trigger back pain, but how? Again, it's like a puzzle that you need to put in, one by one to identify that. But will it be too late once you understand that it is not back pain related, it is pancreas related? How do
Yeah.
we?
I think two things here. Once, I think the first thing is, as I told you, pancreas is very deeply located. Here, if you see in this diagram, is the yellow part is the pancreas.
Mm.
Behind the pancreas, you see the blue and the red color. These are the big blood vessels in the body. And behind this blue and the red color stuff will be the vertebral column or the spine bones. So if you
Okay.
can see here, pancreas is sitting right over the spine bones. Of course, not exactly touching it, but of course, very much deeper within the body. Thus, any problems in the pancreas would be typically contributing to back pain. That's one reason that back pain can happen. But again, as you rightly pointed out that we all sit up, office work. Back pain is so common, and most common cause of back pain is again the bone and the spine, the what we call as musculoskeletal problems. So again, here the analogy once would be, if I see a animal, if I go out of my house tonight, I see a small animal with the stripes, is most likely a cat rather than a zebra. So if you have a back pain, the run of the mill causes are more common. So musculoskeletal, of course, is the first common cause of a back pain. You don't need to worry that you've got pancreas problem. But again, if you have back pain, you are taking some painkillers, you have done some x-rays or some tests, the pain doesn't go away or the pain becomes even worse. And then all these other contributing problems come up like vomiting, nauseating, bloated. Then you have to tie the piece of puzzle together and frame whether this is a story related to pancreas. So again, I think the viewer should not just get too concerned by us putting the back pain and all that. But again, it's tying the piece of puzzle together. And again, it's about persistence of the symptoms rather than one-off moment. And these patients themselves are the best judge. And of course, the second best judge would be their primary doctor, their GP or the polyclinic, whom they have some relationship of trust. So again, don't just take painkillers for back pain. If you're persistent, just get it checked. Yeah.
So, Doc, so coming back to this topic again, so is it good that we should do at least a year of blood tests or maybe 3 months once to identify the markers, to understand where we are at cancer markers, especially? Do you think that will actually help?
I think once I wouldn't be an advocate of doing 3 monthly blood test or say X-rays or say a CT scan. I wouldn't be a proponent or advocacy of that kind of view. Partly because that actually opens up the whole new ball game. Supposedly, I am now about 44. If I go and have say some scan, the scan is 20% likely to show something in my liver, in my kidney, in my pancreas, or in some other random body organ. And then I'll scratch my head. What should I do with this? I've found it. And then I'll see a doctor who will also scratch the head. What should I do and how should I guide this person? And worse of ones, if I have not bought an insurance, but I did the blood test, no insurance company is going to insure me against those diseases of those organs. And insurance companies work very differently. They don't go by disease process by and large, they go by organ. So if you have certain disease of a certain organ, they will exclude that organ itself from insuring you. So in future, you are completely excluded from insurance. So I think every 3 monthly going and checking, probably for all Singaporeans or for all communities, no. The answer is no. But I think there are certain guidelines from our ministry, that probably people should be aware of. And again, your GPs and polyclinic doctors are in the best position to guide. But just to add once, I think the ministry in Singapore has certain screening program. Like, after a certain age, please go and check your blood pressure. Because blood pressure, if it's not controlled, can cause stroke, can cause heart attack. So of course, it's good to go and check. And one of the links with the blood pressure is, of course, cholesterol, lipid and cholesterol. So of course, please go and check all that. But in terms of pancreas, we can't say go and do a tumor marker, because three reasons. Number one, the tumor marker, even though people may have cancer, the tumor marker may be normal. So there's one problem. Then you have a false assurance, that I have no cancer. But the problem is, every time you have a cancer, the tumor marker will not go up. The second problem is, even you have some other condition, this tumor marker can go up. As for example, smoking, active or passive, the pancreas cancer marker will go up. So then you are none the wiser what is the cause of these high marker levels. And the third ones, which I see more commonly, is once the tumor marker is up, then the primary care doctor will refer them to a specialist like myself and other colleagues in hospitals. And then we are none the wiser what to do now with this patient who is perfectly in a healthy condition. He just has one problem, which is a tumor marker which is high. So again, we discuss the pros and cons with the person and then take it further. So I think universal algorithm that everybody goes for a blood test, probably no, not necessary, not advocated. Look out for health symptoms. That's more important than going and getting checked, especially in terms of pancreas. I'm not advocating other things. I'm not an expert as well. But for pancreas, there is no blood test in terms of screening. Yeah.
How about the common reasons, Doc? I mean, why people need to have a pancreatic surgery? Could you please describe that procedure or the unique technique that you'll be using in Tan Tock Seng?
Okay. So I think the most common reason we actually may have to do pancreatic surgery is somebody having cancer. That's the most common reason we will actually touch the pancreas. Anecdotally, sometimes not in the clinical scenario, but in a social scenario, some of us will say, "Don't fiddle with pancreas. Pancreas is like a wife. Please don't fiddle with it. It will get angry and inflamed and annoyed."
Okay.
Yeah, so I think that as far as pancreas is concerned, try not to touch it. Okay. but sometimes there is no choice. We may have to take it out if there is a tumor, if there is a cancer, if there is a worrisome problem. Now, recently, once I just want to add, there is an increasing the detection of this condition called cyst in the pancreas. Cyst is typically a bubble of water. It can happen in livers, kidneys, also in pancreas, many body organs. By and large, if it is in liver and kidney, generally not really cancerous, or generally considered benign. But when that cyst is in pancreas, is a different ball game. Is considered potentially cancerous. Potentially can transform into cancer after say 10 years, 20 years. There is certain risk. So one of the common reason of pancreas operation these days, over last decade, I would say, is a cyst of the pancreas. It's not really a cancerous process. We classify there is a pre-cancer condition. The cyst puts a body or individual at a risk of cancer in the future. So that also is an emerging problem these days. We actually do pancreas operations. Yeah.
Doc, is it true that, because as I mentioned,
Yes.
I mean, you've been a doctor and a consultant for so many years, but I
Yes.
just reading some journals.
Yeah.
When someone goes for a pancreatic, when a person has a cancer and go for a
Yeah.
surgery,
Yeah.
there is a high chances of developing type 2, I mean, diabetes. Is it true?
Yeah.
Or
Yeah.
when partial of your pancreas is removed or whatever, you will develop diabetes. So is that a link there?
I think once the three things to add here. The first thing, each and every organ or even a part of the body, say a hair, I think God has given us it has a purpose. So we wouldn't say hair is useless. Otherwise, imagine yourself looking bald. So everything in the body has a purpose. Similarly, pancreas has a purpose. And the two common reasons the pancreas has is, one is it helps in the digestive by producing enzymes which help in the digestion of oil, and the second, it produces hormones which are certain chemicals which goes into the blood and regulate the sugar balance. Now the second point, God has given everything in excess. God is too kind to us. It has given everything in excess. So many organs you see they are in duplicate, like lungs and the kidney and so on. Some organs which are simple, like heart is one, pancreas is one, but they have tremendous capacity to compensate. So if I remove a little bit of pancreas from somebody, that somebody would not have problems because God has taken care of us very well. The issue is we, by our lifestyle, by our habits, we actually pu- pursue certain unhealthy practices despite being aware that this is unhealthy. It's just a behavioral science. We just get lured to it, and thereby, certain organs of the body will get some disease conditions. Those are they're not optimally functional. Now the third point. So first point is the structure of the pancreas. Every organ in the body is important. The second point here is the pancreas. Good enough. Little bit of operation wouldn't change. The third point, I think there is a real risk if a surgeon removes and that organ was not already optimally functioning by virtue of disease or by virtue of habits or whatever. And now I even removed a part of that organ. Of course, the function will be affected, and the two functions will be, of course, the digestion of oil that will be affected, and the sugar balance, which is your diabetes, as you say, type 2 diabetes. So your sugar balance will be affected. So two things here: the enzymes or the oil digestion, though it is affected, it's easy because there is a capsule. It's just the enzymes are marketed in a tablet and capsule form, so you can just take the supplement and that takes care of your problem. But the diabetes, I think you have to resort to maybe insulin injections, and I would say the risk is in a single digit, below 10% if I do an operation, unless I remove complete pancreas. If you remove whole pancreas, completely different ball game. Brittle diabetes, that means the sugar fluctuation up and down is very sporadic, very difficult to control the fine balance, ups and downs. The swings are very problematic to manage if there is complete lack of pancreas.
Doctor, it just sounds to me like it's in a factory, 24 hours operating without an off day. Especially, we have to give the credits to the heart, HB, because we don't want the guy to rest at all. But you said it so well. We have two, right? We got two lungs, we got two kidneys. But unfortunately, or fortunate thing, we have only one liver and, of course, brain as well. But
Yeah.
understanding the human body is an amazing thing to study about, right? I mean, each of its
Yeah,
functions. If you
yeah,
abuse it, I would like to give. I mean, this is a real incident that happened today morning. As a
yeah,
trainer, as a fitness trainer, I train lots of
yes,
clients. So in the morning, one of my particular client was telling me we have to be very gracious and conscious about our pancreas and livers and heart because they are working hard for us, but we are
yes,
not giving them a break. So I think it is something that we all need to take very
of course.
cautious about it, and
Yeah.
be very religious about it. Not taking good care of ourselves is, I think, is very important.
Yes, I think that's very important these days with our lifestyle, the work-life balance. Though we can see that social media has elevated the awareness, with Google and all that. Now people can just on the fingertips find out about a problem. But what actually are we doing about the problem? Are we interested really to find a solution to this problem, and are we pursuing this for our own gain and benefit as well as our family and friends? I think there's a completely different ball game. Yeah.
Doc, we know that the insulin is such a amazing, phenomenal produced
Yeah.
in our body, right? It
Yes.
just happens itself, right? But
Yes.
of course, we know that without the pancreas, can a person live, or what is the survival rate like? And is there any new therapies available in Tan Tock Seng Hospital to improve these survival rates?
I think you see, without pancreas, of course, can live. As far as you take over the function by other means, artificial means, maybe by tablets, injections, and all that, probably can live. So I would say that a person can live without a pancreas. Now, either you live with insulin injections as well as enzyme replacements, or very occasionally you may actually then pursue what is called as pancreas transplantation or an islet cell transplantation. Islet cells are typical cells in the body. They are the pancreatic cells. There are alpha cells, there are beta cells, there are gamma cells. One of the thing is islet cells, which control the sugar. So I think there is a special procedure called islet cell transplantation. So you inject the human with an islet cells, and they will start manufacturing and regulating the sugar and all that. So all these technology and things are available. Pancreas transplant is possible, islet cell transplantation are possible. These techniques, they are actually not really available in Tan Tock Seng, but they are available in Singapore. So people can live without a pancreas, and I would say that they can probably have a good survival. Survival would be determined by the primary reason why the pancreas was removed in the first place. So survival can be determined mainly by the initial root cause of the reason why the pancreas was removed. Say, as for example, cancer, then what's the stage of that cancer, and so on and so forth. Yeah.
Doc, I learned something today. Your pancreas is your like a wife. You do not want to mess with it, and
Well, we shouldn't
especially
be feminists. On this show, we shouldn't be feminists because that also can backfire.
yeah, yeah. Or
And all.
probably we could say your pancreas is can be your husband. So viewers out there, this is
Yeah,
just a man for a little joke, right? But
yeah,
but again, Doc, I mean, it's
yeah,
amazing to know such an organ does for us amazing things without our permission or approvals, because as long we
yeah,
eat something, the pancreas does something, on its
yes.
own, as well as the insulin. And you said it very well as well. But Doc, but talking about cancers as well, it doesn't comes in size, whether you're fit or unfit, whether you are thin or big size, whether you eat healthy or unhealthy. But in Singapore itself, I mean, especially Singaporeans, how can we reduce the risk of the cancer? I mean, as a general suggestion, Doc.
I think the three things here. The first thing is to know how to reduce the risk of cancer. You need to know what are the causes of cancer. And again, the three common cause of cancer of pancreas are smoking, drinking, and being overweight. So as far as we can control these three things in our life, we will reduce our risk. But are we able to control these three things? That's entirely upon us. So I think we doctors put risk as modifiable and non-modifiable. So smoking, drinking, and being overweight, Being overweight sometimes could be non-modifiable if it's driven by genetics and other conditions, but by and large we relate it to the lifestyle, so we say modifiable. So if there's a modifiable problem, is entirely within your control and you take the supreme charge of it. But there is a little bit of non-modifiable, which we talked earlier about genetic, because that is genes we inherited and there's some mutations or changes that probably can't do much, and that we are left to mutations. We develop cancer. We can't reduce that kind of risk. But good news is that most of the cancers happen because of modifiable risk factors, and we can modify that. So I think we can easily reduce the risk burden. And in fact, it's not top 10 common cancers in Singapore once. And I would say
Yeah.
good and bad. Good is not top 10. We don't want cancer. It's a killer. We don't want that disease at all. It's good. But because it is not so common, there is not much awareness, not many people talk about it. So I think, the pros and cons of not being so common.
Doc, for especially for pancreatic cancer, the high risk factors fall under above 60. What is the youngest case you ever seen?
I think once if you ask me these questions, the viewers will get scared because
Okay,
if you ask
okay,
me youngest case, I've seen people in their 30s with cancer. Because I am a doctor, I see the full spectrum. So I don't want to scare our viewers today. I don't want to get a wrong message. By and large, cancer is a disease of aging process. Because as the body gets older, the cells get a little bit weaker, what we call as telomere, or certain parts of our DNA and all that, they change, they mutate, and that it contributes to the risk of cancer. So by and large, people with pancreas cancer would be say 60 to 70 years age group. Most common is 60 to 70, the
yeah.
decade. Even we have seen people after 70 and all that. But if you ask me youngest, of course, I've seen the 30 plus. If you ask the same questions to some pediatric trained specialist, he will say, I've seen in a child. So is the full spectrum of range. Yeah.
Doc, because for the past couple of weeks, I mean, especially past 1 week, I've been going through the pancreas about the exocrine and the endocrine, the functions,
Yeah.
and it's a big theory, right? It's a big
Yeah.
factory we talk about, but we
Yeah.
also look at the presentations. One should be aware of what exactly is happening to them. I mean, most would just take it as a home remedy, right? Oh, I have a stomach pain, maybe I drink this, but
Yeah.
sometimes it's very important that we need to understand our body. If
Yeah.
more symptoms, the presentations was shown, then I think it is time to see your first contact, which is your GP, and then they will do the necessary things, and then they will suggest what you should do next. I think that is very important for the viewers out there who are watching this. Viewers who are watching this, please do share and like, so that more awareness and exposure on the pancreas will be known to all our viewers and friends. Doc, we have a viewer right now here who asked about the pancreatic cancer. Can a patient recover from it eventually?
I- you have not put the last word. I can read here. Or is it a matter of time?
Yeah, I'm not reading that. I'm not reading that.
I think most of my patients and families also don't want to delve into that matter of time. But let's be realistic here. Let's be honest with my viewers and myself. I think when somebody has a cancer, we have to take a step back. We have to actually now not only treat the patient, we have to treat the disease, we have to treat the patient who has the disease, and we have to treat the family as well, the next of the kin, because though the problem is with one individual, but actually the whole family is suffering from that illness or the experience of the illness. So I think the first and foremost is the duty of a doctor to actually have a correct diagnosis. So we need the accurate diagnosis. And once, sometimes that itself is a challenge. Yeah, I told you pancreas is so deep, we can't just anyhow poke needles and take samples, because there is a risk of injuring the stomach, risk of injuring other organs. So diagnosis itself is sometimes a challenge. Now, once we have done an accurate diagnosis, then we doctors have a duty to bring this whole case discussion in what we call as multidisciplinary team or multidisciplinary tumor board. So there's a group of doctors, from all diverse specialties, oncologists who deal with chemotherapy, radiotherapists who deal with radiation treatments, gastroenterologists who are expert in endoscopy and medical parts of pancreas. surgical oncologists who are a little bit trained in terms of surgical part, a radiology doctor, and they have two different groups. One is a diagnostic and one is an interventional. They can do various things, put in wires and tubes in the various body. So I think all these, and again we have a nurse clinicians and other relevant specialties like pathology doctors, pain specialists, physiotherapists, and occupational. Everybody sits together to determine what is the next best course of action. When that's done, that's brought back to the patient and the family. Discussions are done. Typically, by and large ones, pancreas cancer will require surgery. So we will advise surgery. The problem is only 20 to 25% qualify for surgery because the disease, the patient come too late when the cancer has already grown, expanded, or spread to other body organs. We can't really do operation. It's not possible to do surgery and cure the patient. So therein lies a very important, that such shows by yourself and other medium are done. So people do come early. They come and present at an early stage because 75% of the time we can't do surgery, and surgery is the only curative modality. So I think we can say we are curing the patient, but pancreas is a bit aggressive, so there will be some relapses. Tumor will recur even after an operation. Then you have to get for chemotherapy or radiation. I think eventually it's a matter of time, and it's a matter of time for all human body, even without a disease. Is a matter of time. The clock is not stopping. We all have to go one day. So in the same sense, I think pancreas cancer also, you can, in the same analogy, you can say it's a matter of time, but it's how well is that time spent? What's the quantity and what's the quality of the time? And that's where a doctor or healthcare professional, the team of doctors, would value add to the patient and the family, because eventually it's a matter of time. But how good is that time, taken care of? Yeah, that's important.
Doctor, I mean, it's the third time I'm saying well said. Emotional health of the caregivers and the families plays a huge part.
Yeah,
I think if anyone have ever lost someone, their loved one, to cancer, it is such a draining because you got to be, look, you can't be emotional in front of the person, especially your loved one, right? And
yes,
and it requires a lot of braveness, a lot of blessings. I think it is something that not everyone want to go through it.
yeah,
And I think it is the doctors. I think, like I always say that in my show, doctors are actually the angels that sent down by heaven
yeah,
because you need to protect the humans. So thank you, doctor. Thank you so much for that.
no problem. Yeah,
We are seeing a chart here right now. Correct me if I'm wrong,
yeah.
doctor. I mean, it looks like the cancers on the breast seems to be a little bit more higher, followed by colon and liver as well. What are we looking at these stats, doc? What actually gives us in an overview itself?
Yeah, I think once, to just put in perspective, in 2016, I got a very interesting, student from School of Biological Sciences, and she had to do something for her final year project, 2016. So I think I kind of assisted her to do her final year project, but it was kind of win-win situation because I could then do this kind of a small survey. So she was very enthusiastic, and she helped me do this survey on about 500 healthy participants who came to Tantoxen. Um, these were not all patients. They were, some people were next of kin, families and friends to people. They come to Tantoxen clinic in the surgery department. And we asked them to do some survey. And of course, this was one of the question. I think the survey is very elaborate, but this is just one of the things I wanted to share with the viewers today, that many people are aware of breast cancer, colon cancer, lung cancer. But when it comes to pancreas cancer, I think more than 60% of the participants wouldn't know much about pancreas cancer. And I wouldn't blame them. They wouldn't know because it's not that common, so it's not that common, so people don't talk about it. And people like us doctors, we also have to do our role to do some educational forums and events. So I wouldn't say there is a big disconnect, but I think there is a requirement or a need to raise the awareness of pancreas cancer. And I really commend you for doing this show, because only via
Thank you.
this show and such forums we can actually do that. We can just reach out to the community at large and raise awareness. So that graph is very instrumental. 60% of our populations don't know. about pancreas cancer. People just are ignorant, and not they are ignorant. These are all graduates and postgraduate people, participants were highly educated people, but the awareness is just lacking. Yeah.
Thank you, doctor. Thank you so much for that.
Yeah.
Doc, we coming to the last part of the show, which is of course
Okay.
the screening, because it's pretty. I just want to give you a real incident that happened. I mean, 3 years back, I lost my dad. Perfectly fine, just coughing. So probably anyone would just thought, you know what, you got a sore throat, take some lozenges and be dressed. But but the cough persisted, and then when we went to check, it was already the stage 3 of the last stages. And doc said, you got 3 months to live. Just like how God will say, okay, you're gone in 3 months. But, doc, but it's a bit of a strange to understand the human body. I mean, we live in this body for so many years. But unfortunately, we are not able to understand why some cells are turning against us. And will there be any early detection, especially when we talk about this amazing organ pancreas? Is there any way we can detect, or because most of the cases that is already in the late stages, so how can we prevent this as a whole, doctor? Can you
Okay, good
please?
question, Vance. I think first and foremost, sorry for the loss, for your loss and your family's loss. It's not easy to get over that loss. Uh, Coming to the pancreas and the screening, I think the screening, if you for that we have to understand what is the role of screening. When we say screening, actually it means that you diagnose or detect a disease early when it is still curable beyond, so you don't get it so advanced and late. You actually focus on early diagnosis, and that's the role of screening. I would just say, what are the modalities of screening? So it can be very simple ones. As for example, in breast cancer, we actually teach and educate our the the women, called breast self-examination. You can just feel your body part and feel whether there's a lump or a growth. Again, is that going to be possible for pancreas? No. So we talk of certain organs like colon and stomach. We can easily do an endoscopy. Endoscopy is a long tube with a camera. We insert from the mouth, go inside and check the stomach. We insert from the below and check the colon. Can that be done for pancreas? No. So again, the pancreas is notorious organ. There is not a good screening test available by virtue of its location, etc. And I also spoke about the tumor marker, the blood test. They are also notorious. So there is no screening test for pancreas cancer. So there is nothing. There is nothing. There is no screening. So the only way is to get public awareness, education, awareness, increasing the literacy level. People need to know about it, and that's it. That's the best we can go. Taking a step further, there is a certain role of screening in people who are at higher risk. So I would say the family members, generally, when we say family, we say first degree relatives, direct first degree relation, not the second degree and not really the third degree, first degree. I think if there is a family member diagnosed with a pancreas cancer, that first degree relatives of that person probably should be advised to go and check the pancreas. And the way to do would be some form of scan, like a CT scan or an MRI scan or some form of more accurate scan, which are generally CT and MR. That's probably the way to do the screening. I wouldn't say that all Singaporeans should just go and get a CT scan. That's not technically, feasible or even logistically, feasible. But if you have a increased risk because your family member had a pancreas cancer, there is a chance of mutations and genes and all that being transmitted, then all likelihood talk to your doctor and they will help you understand the screening. And of course, we would then do it selectively. In US, there are certain research protocols going on now with regards to pancreas cancer and identify a screening population and really the benefit of screening. But I think by and large, there is no population level screening program. Yeah.
Doctor, I got to give you lots of credit right now. I'm
Yeah.
not expecting any coffee, but it looks like a semester's training. semester's lesson you have
Yeah.
just covered in 1 hour. And I'm just like your medical student, as well as all the viewers out there who are enjoying and
Yeah.
understanding the awareness as how important and seriousness about this pancreas is all about, Doctor. Thank you so much for your
Yeah.
1 hour that you have spent the time with us, Doc.
Oh,
Before we sign off, is there
yeah.
any last tip or advices to our viewers out there who are watching this for the past 1 hour?
I think I don't have a golden statement or a tip for everyone, but I think I would just say that please have trust in healthcare profession, have trust in your doctor, have trust and faith in the system you are a part of. And system is designed to take care of you. Just be open and share with your doctor openly your issues and the problems you face, and I think doctors would be very happy to take care of you. So I think that probably that's all I want to say. So if you have some things to share, just openly discuss with your doctor. They're there to just help you out. So for me, I guess somebody talking about pancreas, I would be very interested to listen and see how we could actually help, because the focus is not on treating the disease, but the person who actually is suffering from the disease. So I think it's very important to have some trust in the system, whichever system you rely on, GP, polyclinics, tertiary hospitals, Tantoxin hospital, or wherever. Just have some trust, work with your doctor, and of course he or she will do their best to assist you to go through and go through the process, or the journey for your recovery. Yeah.
Thank you, Dr. Vishal, for your
Yeah.
precious 1 hour for joining me at Kopi Advance, and also a great gratitude and appreciation to Tantau Singh Hospital and to support Kopi Advance for this segment. Thank you, Doctor. We will definitely
Thank
catch up for next
you.
Kopi Advance.
Thank you so much. Sure.
Thank you,
Have a
Doctor.
good
Thank you
evening.
so much.
Yeah.
You
Thanks
too.
a lot.
Thank you. All right, so viewers, thank you so much for joining me at Kopi Advance. That is Dr. Vishal, is a senior consultant in Department of General Surgery at Tan Tock Seng Hospital. Thank you so much, Dr. Vishal, for spending your precious 1 hour, and also to Tan Tock Seng Hospital. So yes, it's an interesting topic. We understand. I think we have pretty much finished the month of November on diabetes and pancreas, and we also have a dietitian who came on board and to talk about it. I think it's an amazing month. We at Kopi Events has dedicated this month of November to the human body, which is very important, which is the pancreas is the responsible of your endocrine and your exocrine. A lot of functions, a lot of things that it does without we realizing, or without we giving approvals. I mean, it's an amazing thing. We got to keep on studying about our body. If something, there's a pain or there's some kind of lethargicness, that's a kind of a signal that the body is telling you, hey, look, you need to go and check it out. But if we don't listen to it, it gives warning signs, right? It gives you ample of warning signs. It breaks down, it slows you down. But if we are not listening to it, then probably it will send you some kind of signals, a major breakdown. So thank you to all the viewers who have just joined. Thank you, Samantha. Thank you, Yenping, and also to a lot of people who just joined. Thank you so much who have just joined. We are coming out with a different and exciting topics on the month of December. So stay tuned. For now, it's for me to sign off and have a strong cup of coffee. Till I catch you again, this is Vance from Kopi with Vance. All right, I see you. Bye bye.